We're a family medicine residency program here in Southern Illinois, the only residency program in this town, actually. We work both in our clinic here, which we have a brand new building that was just opened last September in 2019. And then also we train in a semi-hospitalist fashion, caring for our adult patients who are admitted from our clinic. So that helps with our continuity of care.
One of the biggest things for our particular program is that we're an unopposed program, and what that means is we have access to resources. The biggest being our communication with specialists. We have a wide range of specialists that we directly communicate with one-on-one. So there's a lot of learning that comes from that.
Let's say there's a procedure going on with the pulmonologist doing a bronchoscopy. There's no other residents that would be there to potentially use that opportunity, and so those all fall to us just by virtue of being the only program there and the only program in this area for residency training.
If you want to go to a program and you're not really sure exactly what you want your practice to be, this will give you a good picture. We have graduates from the program that have gone into practicing only OBGYN, hospitalist positions, outpatient care, even ER medicine, emergency medicine. So that was a big thing that I underlined, and I was like, okay, this is unique.
We are now a federally qualified health center, or an FQHC. What that's going to allow us to do is broaden our spectrum in terms of the type of clinic patients we see, the amount of clinic patients we see. Residents and medical students will have opportunities to see acute care visits, things like strep throat or whatever you would normally see coming through in urgent care. Additionally, we'll have psych services. We have a psychiatrist 1 day a week, so now we have those services offered to our patients and likewise offered to our residents to get more psych experience. And also we're hiring multiple social workers and community health workers so we can work on population health, education, and experience as well.
No matter what environment you're placed, whether it's behind a book, behind a desk in the library, or in a clinic, or in a hospital, having the drive and the motivation to learn. Because learning is something lifelong for a physician. It's not just part of medical school or residency. So that mentality or that attitude, maintaining that all throughout your training and beyond, I think is essential. We're promoting and training the residents to offer compassionate care. I think that's an important part of our value and mission statement for our clinic.
What got me excited was the continuity of care between a doctor and his or her patients, so that you know them from the time you meet them and you can have a relationship with them for 10, 20, maybe 30 years and know where they've come from, where you've been together, and where they're going in terms of their health.
We're taking on a group of med prep program medical students to mentor them, to teach them, kind of guide them along their process of finding their career in medicine. That's exciting to me. I like teaching, and so being in that position, I think, is perfect for me. And I think it's part of our program's pride, really, is that academic teaching component.
The volume of experience and the type of experience you get not only in family medicine but in other specialties is unmatched by most places. The idea that you could be caring for adult patients on the floor, serving as a hospitalist, next second you could be delivering a baby on the OB floor, that kind of variability is really useful for getting that wide variety of experience.